rolling into our talk show like. Hello, my name is Kaylee Graham. Do you feel you aren't healthy because you don't have nationalized health care, or do you feel that it's unfair that the rich have to pay for the poor? Well, today with me is my partner, Hunter Grunwell.
I'm glad to be here to inform the citizens.
Also, we'll have two other guests this evening. We'll have Jordan Gonder and my mother, Danielle. We will talk to them later in the talk show.
Well, let's begin. Before me and Kayla state our sides on this very bad issue, we're going to talk about key points.
Healthcare falls under the purpose of government as promote the general welfare. People may say, what does that even mean? And a lot of people don't know what it means, but right now, I'm going to tell you. Providing healthcare would improve the country's well-being and also increase the quality of life for all individuals. You may still have questions, but just sit down and hold tight. I'm sure we'll answer all of them by the end.
Overall, it comes down to federal or state government. Well, you may say state is the one that controls nationalized healthcare, who pays for it, but really it's federal. And meaning by federal, it means that Congress does it. Okay, now sitting with us we have Dr. Golden defending her position. Hello, Dr. Golden. Thank you for coming to see us.
Oh, it's a pleasure. I'm happy to be able to take my position on this important topic.
Let's start off with the basic overview. I understand that you are for national health care. Can you explain why?
Correct. Well, there's a long listing as why, but I'll give you my top three. Creating a nationalized healthcare would improve the quality of life of people and also the well-being, and also make people healthier. In 1840, people lived to about 37 years old, which if you think about it, most of your parents wouldn't be alive today. And in the 2000s, people are living to about 78 to 79 years old. And that's a lot more than 47. Would you rather live to 47, 37, or 79? We want to increase that number in the further centuries. Also, another typical issue is social classes. There's always the middle class, lower class, higher class, and depending on how much you make, that's depending on how much money and how much health care you get. But with this problem, nationalized health care, it can give you a equal health care among all the social classes. So this would diminish all the social classes overall. Lastly, nationalized health care would improve the economy. Now think for a minute. If you were a doctor and you didn't have health care coverage and you had a bacterial infection or a different disease, you would have to miss typically 5 days of work to just get better because you didn't have the necessary coverage to get better. And when you're sick, then that means that your patient doesn't get the necessary care that they need because you're not there to help them. If you had nationalized health care, and then you wouldn't have to miss work. You would be able to help others and also help yourselves.
I'm still not convinced that nationalized health care is the right thing for the U.S.
Well, in recent studies from 2011 to 2014, there was 44,789 deaths that were related to health-related incidents. That should not happen. 11.5% of people were uninsured in the United States. That's about 36 million people. In 2014, 16.5% of people were uninsured for only half the year. That's about 51.6 million people. And then also, 8.4% of people were insured for the whole year. That's about 26.3 million people. If you think about it, 11.5% of people were uninsured, and only 8.4% of people were insured. Would you rather be uninsured or insured? I'm pretty sure you'd rather be in the insured group.
I didn't realize how much people were at risk.
Nationalized healthcare has been a problem for centuries, but many haven't taken the opportunity to figure out how we need to help it. But I think we need to start today. Our recent President, Barack Obama, has passed the Patient Protection and Affordable Care Act to provide Americans with necessary health care. And we're going to talk about that right now.
Let's talk about the Affordable Care Act, also known as Obamacare, and what it means for you. Say you've got private health insurance already. Maybe you have it through your job or your parents. Obamacare means you get a host of new benefits and protections. For example, insurance companies are now required to cover women's wellness visits, mammograms, birth control for women, immunizations for kids, all without charging you a penny more. That means no extra copays or fees. Young adults can now stay on their parents' plan until they turn 26. Insurance companies can't limit the amount of care they'll cover over your lifetime. Also, if your insurance company spends more than 20% of your premium dollars on overhead, stuff like CEO salaries, marketing, administrative costs, they have to send you a refund for the difference. In January, that list of benefits gets even longer. It will be illegal to charge you higher premiums or refuse coverage because you get sick or have been in the past. Charging women more than men for the exact same coverage, also illegal. No more deciphering page after page of jargony paperwork from your insurance company to determine what they will or won't cover. Instead, you'll get a short, plain language summary of your benefits and coverage. Easy, right? You can learn more at healthcare.gov. Okay, what about the folks without health insurance or people who buy coverage on their own? Here's what Obamacare has for you: a new, simple way to buy affordable, high-quality health insurance. Starting October 1st, you can go to healthcare.gov and use the new health insurance marketplace to see all of the health plans available in your area and sign up for the one that fits your needs and your budget. You can also find out if you're eligible to pay less for private health insurance or whether you qualify for other free or low-cost programs. All the plans in the marketplace are required to cover a core set of essential health benefits: doctor's visits, emergency care, prescriptions and lab tests, rehab for illness or injury, mental health services. They all come standard. Plus, all those benefits and protections available to people who already have insurance: no-cost preventive care, coverage for pre-existing conditions, accountability for insurance companies. You get all of that, too. You can apply for marketplace coverage 4 ways: online at healthcare.gov, by mail, on the phone, or in person. And open enrollment starts October 1st. You can learn more right now by visiting healthcare.gov or calling 1-800-318-2596. So here's the bottom line. Whether you need health coverage or you have it already, the Affordable Care Act offers new rights and protections that make coverage fairer and easier to understand.
Obamacare establishes the core democratic value of life.
CDV, what does that mean?
Life as an individual's right to life should be considered sacred except in certain highly restricted and extreme circumstances, such as the use of deadly force to protect one's own or others' lives. This specific value demonstrates nationalized healthcare because, we stated before, 44,789 deaths occur because of health problems. These innocent people's lives were taken by a health incident. Everyone should be able to live their lives and not worry about, oh, am I going to die tomorrow?
One last question to conclude your interview. Are there any real-life examples where healthcare insurance was being helped with or being paid for where people couldn't afford it?
In fact, there is. There's a court case, King versus Burrell. There was an incident whether citizens should or be granted for grants to cover their healthcare percentages and amounts. The overall conclusion of the case was that many people with the health insurance and without the health insurance would be affected, with either losing their insurance or continue to have none. The most likely to be affected would be whites, employers, and high school graduates. Overall, this shows how the U.S. should have nationalized healthcare because without the help of the government, people would be unable to make monthly doctor visits due to healthcare being too expensive. Grants need to happen.
Wow, thank you so much for conducting this interview with me, and overall, I do believe nationalized healthcare should be available.
Dang it, I missed my interview with Dr. Golden. What a terrible coworker I am. But Hunter doesn't know that I brought in Dr. Klein to talk with us today about her position. Welcome, Dr. Klein. Thank you for being here today. We recently had an interview with Dr. Golden talking about why we should have nationalized healthcare. What are your takes?
You talk to Dr. Golden, she thinks she knows everything, but in real life, I would be the one to tell you why nationalized healthcare should not be permitted. Trust me, I do more persuasive argument than she ever would be.
Well, Dr. Klein, why are you so strongly against nationalized healthcare?
Well, I have 3 points: waitlist, coverage versus care, and taxes. The waitlist is because when you have nationalized healthcare, there is 50% more people needed assistance than ever. So everyone's going to need assistance, and we're not going to have many doctors and stuff, and it's just going to all not really work out. We're going to have wait lists that are very long. And my second point is coverage versus care. Overall coverage is different than overall care. Our coverage would be treating them for what they actually need and not actually caring for them for what they're going to have to need. Like, there's surgeries that people won't get approved for on nationalized healthcare. We'll also have a problem with taxes. Our taxes will go way up and people have to pay more out of pocket just for nationalized healthcare. So I honestly don't agree with nationalized healthcare. And I don't agree with Dr. Golden one bit. Diminishing social classes, no. Helping the economy, no. The rich should not have to pay more in taxes for the poor to have health care. There will always be social classes, no matter the century we live in. Lastly, federal revenue and energy saving is what helps the economy, not nationalized health care. Let me give you some facts.
Do you have any evidence to back up your claim?
Of course. To back up my first claim, in 2005, the Chief of Justice Supreme Court stated that patients die while on the wait list. Now, if you don't believe that, I don't know if you believe anything. On average, in 2014, it would take up to 18.5 days to ever be seen by a doctor or specialist under nationalized healthcare. Nationalized healthcare causes a shortage of doctors in the medical field, less doctors, less treatments for patients. In addition, I have a couple waiting cartoons to explain why more nationalized healthcare is not a good choice and why the wait list is more of a death list. For my first cartoon, I have a guy right here, and he's making a decision between his third and fourth abdominal muscles. He's on the phone with his doctor. Shouldn't you be doing this? He's asking. And this whole problem is because he's not able to see a doctor because of the wait list. We have 3 people at a cemetery. One says, things are looking up, Lois. You're next in line for radiation therapy. And the next one says, you know that heart surgery you're waiting for? And the next one says, good news, Phil, a hospital bed just opened up.
I remember long ago that on the Declaration of Independence, nationalized healthcare wasn't needed. Is that correct?
Absolutely. For a specific historical reference, people argue that we need it, but nothing in the Declaration really says that we need it, that we have to have it.
Well, thank you, Dr. Klein, for all the important information that we needed.
Well, we heard from 2 doctors. Now we'd like to get a point of view from other people.
We will start with Jordan's first. Healthcare. Are you available to talk to us about your stance?
Yeah, sure.
Can you tell me your position on nationalized healthcare? Do you agree or disagree?
Oh, I totally disagree with nationalizing healthcare.
Why?
Well, I watched some of your earlier interviews, and one thing that I'd like to refute is Dr. Golden's comment about how it will help the economy. Actually, it would lower the economy and it would hurt the economy. You would basically eliminate all insurance companies, and you would eliminate the competition between insurance companies. And this great nation of the United States of America was founded on entrepreneurship and new ideas and companies offering better deals to one. If company A offers a deal and company B offers a deal, the shopper should be able to choose between which one they want. So when you eliminate that competition between those insurance companies, not only are you hurting the insurance companies, costing Americans jobs, but you're also eliminating any money that would be fed into those insurance companies. You're just making more unemployed people. You're hurting the economy even more than it already is. And you're taking away from people who have worked hard their entire life to get to where they are. And that isn't fair.
Well, thank you so much for stating your opinion. It was greatly appreciated. Unfortunately, our mother Danielle was not able to be here with us today. But now we have my stepdad, Fred Jones, to talk about his position. Now, do you feel that nationalized healthcare is a good thing or a bad thing?
I totally support it.
Why?
Because we are one of the only countries on the globe that doesn't have it.
Good statement. Thank you. Hunter and I both want to say thank you for all of our guests that were with us and giving us feedback. But also, thanks for watching. Hope you were informed and can take a stance on your particular side for yourself.
Thank you for watching.